A very good afternoon to everyone. Welcome to today's session on factors determining IVF success rate. And to speak on the topic today, we would like to welcome Dr. Garima Sharma, our in-house infertility specialist. She has done her MBBS, MS in obstetrics and gynecology, DNB in obstetric and gynecology, and she's also gold medalist and fellow for reproductive medicine. We welcome you, doctor. You can now take over the session.
Thank you. Thank you for that kind introduction. And I think after a long gap, I'm back here to discuss another topic, which is about factors determining IVF success. And majority of you, directly or indirectly, who have been involved in this process, must have pondered over this basic question that when we go to any doctor and ask for an IVF, the only answer that we get is IVF never guarantees you 100% success. So, are there any factors which can improve the success rate? And this is what I'm going to discuss today. So IVF, I think we all know by now the conventional way of saying it is a test tube baby or an in vitro fertilization, wherein we take the eggs from the female partner, fertilize it with the sperms of the male, and the embryos are created in the laboratory. And one or two embryos are then transferred into the womb of the intending mother, and the remaining embryos are stored for future use. So this is now not a new technology, and it has been more than 4 decades that we have been into an IVF. And as in how the science progresses, we have automatically seen an improvement in the technology, which has reflected in terms of improved success rates and better safety profile of this particular treatment. Now, as I started my talk, and which is a fact that wherever you go across the globe, IVF, we can never ever guarantee you a 100% success rate. Yes, compared to a natural pregnancy, which gives you a success rate of about 7 to 8% per month, the IUI would automatically improve with 18 to 20% a month. IVF gives you a better success rate of 40 to 65%. Now, having said that, this 40 to 65%, are there any factors which either you or me as a clinician, or to be precise, we as a team, need to keep in mind that can improve our success rate? Now, before I jump to discussing these factors, a lot of people they come and tell me that, doctor, you have been doing everything outside. You have created embryos, now you're transferring these embryos, and why still the success rate is limited? The reason is that having created the bestest of the embryos, creating a good uterus lining, there is no way that you can tell this embryo, you can put a glue on this embryo and tell go and stick to the uterus. The implantation, that is the attachment of the embryo with the uterus, is going to happen completely naturally by the body. So over here, we can of course do certain things to improve or optimize the implantation rate, but cannot make it to 100%. Now, discussing about the factors which are going to improve or which determine the IVF success rate, I'm going to categorize it into 3 categories. The first is the couple characteristic. The second is the clinician perspective. And the third is the embryology lab standards. So, if I talk about the first part, that is the couple characteristics, age of the female is the most important part which determines your success rate through any fertility treatment. And through my earlier lectures also, I have been doing a lot of talk on the importance of aging and the impact on the fertility. So we all know that by that there is no magical number to say, okay, at this number you have come into the red zone, and before this you are into a green zone. So there is no fancy number of 35 which defines someone with an advanced age or a low success rate. In general, we always advise that post 30, there is automatically going to be signs of aging in terms of reduced egg forming capacity, both in quantity and quality. In very simple words, इसका मतलब सिर्फ ये है that after 30, आपकी egg बनाने की जो capacity है, quantity and quality में ये decline होगी. बट किस रेट पे डिक्लाइन होगी वो बहुत डिफरेंट है हर फीमेल के लिए. इट इज डिफरेंट फॉर female A, it is different for female B. So how can you check it? Like you check your physical health, आप अपना hemoglobin कराते हो, thyroid कराते हो, sugars कराते हो, एक fancy सा annual health checkup package ले लेते हैं. The same way, it is a good idea to evaluate your reproductive health post 30. The second factor which determines a success rate is your duration of infertility. So, if it's a very long standing, you have been trying for more than 5 years, then possibly we are dealing either with an egg quality or a sperm quality or a uterus quality or a combination factor, and which in itself is acting as a low success rate parameter for an IVF. The third component is what is the cause of infertility. तो कुछ कंडीशंस रहेंगी जिनमें हमारा प्रोग्नोसिस या सक्सेस रेट थोड़ा बेटर रहेगा, एंड कुछ कंडीशंस रहेंगी जिनमें ऑटोमेटिकली आईवीएफ सक्सेस रेट भी कम रहेगा. So let's first talk about good prognosis condition. Now, if I'm doing an IVF for a young girl who has come to me with a tubal blockage, जिधर IVF का reason एक tube block है, automatically the success rate is more because the egg quality is better, sperm quality is better, and uterus quality is better. Second is a PCOS female who has tried multiple cycles of natural planning, IUIs, but still not come to a success rate. Again, this female has little better IVF success rates. Third is an unexplained infertility, wherein you have been trying since long, you've done multiple cycles of an IUI. Largely, egg reserve is good, sperm factor is fine, uterus is fine. Then also IVF gives you a better success rate. Now, coming on to those conditions where the IVF success rate is going to be low. So, as I said, the first one was an advanced age of the female and a low egg reserve. So, this always goes in combination. So, the lower is the egg reserve, the lower is the number of eggs that we get in an IVF, and lower is the egg quality. That automatically leads to a lowered embryo quality and therefore lower success rate. The second condition is when there is a very bad endometriosis for any female. So endometriosis is a condition wherein there is a cyst formation, where there is a retrograde blood formation into the pelvic organs, and that also indirectly or directly impacts your egg reserve, and therefore this further declines your IVF success rate. The next in category is a very poor sperm count. So where the sperm count or the sperm motility or the sperm morphology or all these factors are involved, again a lower prognosis case. The having evaluated the egg, the sperm, the next in category is the uterus. So there are certain females who have undergone multiple abortions, and for them there have been multiple DNCs. So as a result of which sometimes there can be additions, जिसे हम पर्दे बोलते हैं, यूट्रस में पर्दे बन जाते हैं, जिसकी वजह से यूट्रस की कैपेसिटी एक बेबी को कैरी करने की कम हो जाती है. या फिर there has been a previous surgery on uterus, someone with fibroids, a big fibroid, and who has undertaken a surgery also declines the success rate. The next factor is whether it is a single factor or it is a combined factor. So if I'm obviously doing an IVF for, let's say, just a tube factor, that is a much better prognosis. But if I'm doing an IVF for a low egg reserve and a low male count, where there are two factors involved into an IVF, automatically the success rate would decline. So as far as the couple characteristics are concerned, we always say the age of the female, the cause of infertility, the duration of infertility, and how many factors are you dealing with, whether it is one factor or multiple factors. These all four things are going to determine your success rate. Now coming on to my end, that is a clinician's perspective. So first, remember the word which I'm going to say is individualized therapy. So earlier, when we were limited in our resources, when there were not many centers, there were not many technology, because of lot of limitations in our hand, there was a concept of doing a batch IVF. That is, about if I'm doing 8 or 10 IVF cycles, everyone's medication starts on the same day and the IVF pickup would happen on the same day. But gone are those days. Every couple is different. The cause of infertility is different. The treatment proposed is different, technique is different, so it has to be individualized. So when it comes to a doctor's perspective, first of all, identifying the problem, guiding the couple thoroughly about the realistic success rates, choosing the right protocol, that what treatment are you going to offer, what medications, which dose? Do you need to do any kind of a pre-treatment before starting an IVF stimulation? When should you give a trigger? What kind of a trigger you should give? Whether you should do the embryo transfer in the same cycle, or to bring the periods, do it in a natural cycle. Should you transfer one embryo? Should you transfer two embryos? All these factors would also determine your IVF success rate. Therefore, a clinician's expertise in deciding the treatment protocol and executing the treatment is equally important. The third parameter is the embryology lab and the embryologist skill, the main place where your embryos are getting created. So you can never forget the importance of an embryology lab. Now, a word called as, in our scientific terms, quality assurance and quality control. So in a lot of non-medical background also, we have used these terms of QA and QC. That means ensuring on a daily basis all fine parameters as small as your temperature of the lab, the air quality of the lab, the pH factor of the lab, any dust particles, these all have to be monitored on a daily basis. And therefore, you need to have a full-time embryologist in your lab who can do these daily monitoring and can ensure that the laboratory standards are not affected. The second is the skills or the hands of the embryologist who is actually doing the procedure of creating embryos, that is ICSI, freezing of embryos, defreezing of embryos. So that finesse in hand, the technology, the skills of those hands are equally important in improving your success rate. The third, a lot of you have heard this term of blastocyst, that is a day 5 embryo. So blastulation rate of a particular embryology lab, कि इस लैब में अगर हम अच्छी क्वालिटी के एम्ब्रियोज देते हैं तो कितने एम्ब्रियोज डे 5 की स्टेज पे पहुंचेंगे, वो आपकी लैब का सक्सेस रेट डिटरमिन करते हैं. So a good blastulation rate also tells you that this is a good center with a good lab and a very well-trained embryologist. So to summarize, there are two things that you need to keep in mind. One, timely identification of your problem and wisely choosing your treatment. So if you need an IVF, choose it in the right time, choose it at appropriate age so that later on you don't invite new problems coming in. And secondly, equally choosing a right center where you have all the facilities in-house, where you have a dedicated clinicians and embryologists who are taking care of your case from the starting till the execution. I think all these, it's a teamwork. It can never be you or me. It is us in this journey, and that's how we can at least come to that 50-60% of that success rate. So with this, I am open to all the questions, and I can see my chat box full of questions already. So starting with the first question, what are the factors limiting the success rate of IVF? I think the entire talk was about it. So starting from the couple characteristics to the clinician skill to the standards of the lab and the embryologist skill, all these factors are going to determine your IVF success rate. The second is how to make IVF successful the first time. So let's not narrow this down to first time. See, for me, whether it's the first time or it is the second time, the success rate when you offer or when you come to a treatment, you have to give your best shot in the first treatment. So as I said, first of all, from a couple's perspective, identifying your problem. Don't procrastinate. Don't delay your pregnancies. Don't delay your biological aging. You can plan your pregnancy. You might delay your pregnancy for whatever reasons, but at least at the right time, get your ovarian reserve, your semen parameters evaluated, so that if there is any alarm bells coming in, then you can think of options like an oocyte freezing, an egg freezing, or an embryo freezing. The second thing is, the second parameter would be, if you have decided onto a treatment, then choosing a right center, wherein, as I said, it is very important to have a clinician and a full-timer embryologist, a good lab, wherein from the beginning till the end, your case is dealt by one team. These are all the factors which are going to determine your IVF success. The second is second cycle of IVF more successful? It does not generally work that if the first cycle is giving me 30% success rate, then the next cycle gives me 50% success rate. The only difference is, see, whenever we have to transfer, we will always transfer the best quality embryos in the first go. We will not wait for someone to come with a negative pregnancy and then do your homework and then transfer the good quality embryos. Yes, but if someone has failed because the IVF success rate is limited, it is not 100%, you will automatically look out for some advanced diagnostic test or advanced techniques to improve the success rate. So you would always work from the beginning to have the bestest success rates in the first cycle. If the first cycle has failed, then you and your clinician decide whether any advanced treatment or any advanced test is required. Why does IVF fail with perfect embryos? So, as I said earlier, that there are multiple factors. Now, let's first define what is a perfect embryo. Now, perfect embryo or a grade A embryo is an embryo on our assessment through the eyes. That is when we look into the microscope and see the embryo. We grade the embryo by saying that, okay, today it was expected to reach to this size. Has it reached or not? Whether the cell size is what desired has been obtained or not. Are there any other parameters which are lowering the morphological grading or not? So this defines whether it is a grade A, grade B, or grade C embryo. What we do not know is that a grade A embryo or a good quality embryo is it genetically normal or not. Now, every female we can't subject to a genetic testing before transferring these embryos. So that is why I said that first of all, doing your homework. Where are you doing an IVF? Are you anticipating a genetic problem? Should you be offering a genetic testing before transferring the embryo to this couple? All these things are the first step to before you claim your perfect embryo. The second thing, having transferred a good embryo, you have checked for a genetic screening, for you have done the genetic screening for the embryo. Your uterus lining is also fine. You remember the first line when I started my talk, the implantation, that is the sticking between an embryo and uterus, is not controlled by any science or any medicine, and that is why the maximum success rates could reach up to 65%. What is the success of pregnancy after IVF? Yes, so for the other audience, what she wants to ask me is that you have achieved a pregnancy. Now, what is the success rate in your 9 months? Does IVF put you at a higher risk of a miscarriage? Does IVF put you at a higher risk of a abnormality in the child? Does IVF put you into a higher risk of preterm delivery? So the success of your pregnancy is not determined by the way you have got pregnant, whether you have got pregnant through natural pregnancy, through an IUI, or through an IVF. The success of your pregnancy would be determined by what is the age of the mother. So whether we were dealing with lower quality eggs and lower quality embryos, which could have led to a genetic abnormality. Multiple other factors, whether it is a multiple pregnancy. So is it a twin pregnancy, which could lead to a preterm birth? Genetic abnormality would not come as a result of an IVF. Genetic abnormality in a child will come as a result of advanced age of the mother or the father. So these factors will determine your pregnancy success rate after IVF. In fact, we always tell couple that we are not going to put you on bed rest just because you have conceived through IVF. We're not going to declare that you are going to deliver by a C-section because you have conceived through an IVF. So your 9 months are determined by your characteristics. Sorry. So the next one is, just a minute. What is unexplained infertility? I think the most frustrating diagnosis that comes from a clinician's end. So unexplained means that the four basic things that you need for a pregnancy: eggs, sperm, the uterus, and the tubes. You have evaluated all these four parameters and all the parameters are fine. You have been trying for pregnancy since long. You have done IUIs, but no results. And then your clinician says that probably you as a couple are heading towards unexplained infertility, meaning that there could be subtle quality issues related to the egg, to the sperm factor, which is either preventing fertilization, that is the fusion of the egg and the sperm, or the implantation, that is the sticking of the embryo to the uterus. So what to do about it? Now, first of all, in case of, say, of unexplained infertility, generally 2 or 3 cycles of an IUI or an IVF will automatically give you better success rate, because especially in an IVF is the only time when you're taking out eggs and seeing it under a microscope, that what is the quality of the egg. In all your earlier treatments, you just see on the ultrasound the number of eggs that are growing, the egg has ovulated or not ovulated, but you can never see or comment on what is the quality of the egg which has ovulated. That is why unexplained infertility will have much higher success rate with IVF rather than your conventional treatment. Then, are there risks to having a baby through IVF? I have already discussed about it. So IVF does not determine the success rate of a pregnancy or genetic abnormality to the child, as and how you keep on delaying the pregnancy age post 35. That is, when I say post 35 or post 38, this is largely I'm representing a female age number. The egg quality declines, and therefore the probability of having genetic issues in the child or miscarriages, they are little higher in these conditions. So that is why we always say a stitch in time saves nine. Either you plan your pregnancy, or if you want to delay your pregnancy, you think of an egg freezing or an embryo freezing, so that you don't have all these complications coming out of age. So I think we are almost done with these questions. I will still be available on our Apollo fertility link for any of their questions. My only take-home message to each and every couple in my all talks is, we as clinicians are always there to talk to you about your doubts, to allay your concerns, give you scientific advances. Not every woman needs an IVF, that is the bottom line. But you have to pick up the right time. If you kind of procrastinate or delay your treatment, then there are certain limitations in our hand as well. So it is always a team effort, it is always a cross dialogue between us and the couples, and then the end results will always be beautiful. Thank you, and I will be hoping and waiting to see you again with another interesting topic. Thank you. Namaste.